A 55-year-old male, with a history of intravenous drug use, presents to the emergency department complaining of fever, chills, and fatigue. On examination, he has a new-onset murmur and splinter hemorrhages on his nails. Laboratory results show an elevated erythrocyte sedimentation rate, ESR, and a positive blood culture for Staphylococcus aureus. What is the priority nursing action for this client? A. Administer antibiotic therapy as ordered. B. Elevate the head of the bed and place the patient on oxygen. C. Assess the client's pain level. D. Educate the client about the importance of regular dental hygiene. The correct answer is A. Administer antibiotic therapy as ordered. Explanation: the client's clinical presentation, including fever, chills, new murmur, and positive blood culture, suggests infective endocarditis. Staphylococcus aureus is a common pathogen associated with endocarditis in intravenous drug users. Placing the client on contact isolation precautions helps prevent the transmission of the infection to others, as Staphylococcus aureus is highly contagious. Administering antibiotic therapy, assessing pain level, and educating the client about dental hygiene are important interventions but are not the priority in this situation. A 68-year-old female, with a history of rheumatic heart disease, is admitted to the hospital with signs and symptoms of infective endocarditis. The nurse reviews the client's laboratory results and finds an increased erythrocyte sedimentation rate, ESR, and positive blood cultures for Streptococcus viridans. What is the primary nursing intervention for this client? A. Administer intravenous fluids to maintain hydration. B. Administer prophylactic antibiotic therapy as prescribed. C. Assess for peripheral edema and weight gain. D. Instruct the client to perform deep breathing and coughing exercises. The correct answer is B. Administer prophylactic antibiotic therapy as prescribed. Explanation: the client's clinical history of rheumatic heart disease and positive blood cultures for Streptococcus viridans indicate infective endocarditis. Prophylactic antibiotic therapy is essential to manage the infection and prevent complications. Administering intravenous fluids helps maintain hydration. Assessing for peripheral edema and weight gain is important for monitoring fluid balance, and instructing the client to perform deep breathing and coughing exercises helps prevent respiratory complications, but they are not the primary interventions for infective endocarditis. A 30-year-old male, who recently underwent a dental procedure, is admitted to the hospital with a fever, malaise, and new-onset heart murmur. The nurse suspects infective endocarditis and assesses the client for complications. Which assessment finding requires immediate nursing intervention? A. Petechiae on the client's chest and abdomen. B. Irregular heart rate of 110 beats per minute. C. Mild shortness of breath with exertion. D. Blood pressure of 128/78. The correct answer is A. Petechiae on the client's chest and abdomen. Explanation: petechiae are pinpoint, non-blanching, red, or purple spots that indicate microvascular hemorrhages. They are associated with systemic embolization, a serious complication of infective endocarditis. Immediate nursing intervention is required to prevent further embolization and potential organ damage. While an irregular heart rate, mild shortness of breath, and blood pressure within normal range should be assessed and managed, they do not indicate an immediate life-threatening complication as petechiae do. A 62-year-old female presents to the primary care clinic, complaining of shortness of breath and swelling in her ankles. Upon auscultation, the nurse detects a high-pitched, blowing sound during systole at the second intercostal space, the right sternal border. Which heart sound is most likely present in this client? A. S1. B. S2. C. S3. D. S4. The correct answer is B. S2. Explanation: S2 represents the closure of the aortic and pulmonic valves and is heard as a high-pitched, blowing sound during systole at the second intercostal space, right sternal border. The client's symptoms of shortness of breath and ankle swelling, along with the location of the sound, indicate potential heart failure. S1 is the first heart sound, heard during closure of the mitral and tricuspid valves, while S3 and S4 are abnormal heart sounds associated with ventricular dysfunction and are typically heard during diastole. A 48-year-old male presents to the emergency department with complaints of chest pain radiating to the left arm and diaphoresis. The nurse auscultates a harsh, loud, blowing sound heard best at the left sternal border during systole. Which condition is most likely causing this abnormal heart sound? A. Aortic stenosis, B. Mitral valve prolapse, C. Ventricular septal defect, D. Atrial septal defect. The correct answer is A. Aortic stenosis. Explanation. Aortic stenosis is characterized by the narrowing of the aortic valve, leading to turbulent blood flow during systole. The harsh, loud, blowing sound heard best at the left sternal border is known as a systolic ejection murmur and is characteristic of aortic stenosis. Mitral valve prolapse is characterized by a mid-systolic click and late systolic murmur. Ventricular septal defect and atrial septal defect are both associated with holosystolic murmurs heard at the left lower sternal border and upper left sternal border, respectively. A 65-year-old male presents to the cardiology clinic with complaints of fatigue, dyspnea on exertion, and peripheral edema. Upon auscultation, the nurse hears a low-pitched, rumbling sound heard best at the apex during diastole. Which murmur is most likely present in this client? A. Aortic regurgitation. B. Mitral stenosis. C. Tricuspid regurgitation. D. Pulmonic stenosis. The correct answer is B. Mitral stenosis. Explanation. The low-pitched, rumbling sound heard best at the apex during diastole indicates the presence of a diastolic murmur. Mitral stenosis is characterized by narrowing or obstruction of the mitral valve, leading to turbulent blood flow from the left atrium to the left ventricle during diastole. The client's symptoms of fatigue, dyspnea on exertion, and peripheral edema are consistent with the hemodynamic consequences of mitral stenosis. Aortic regurgitation, tricuspid regurgitation, and pulmonic stenosis are associated with different murmur characteristics and anatomical locations. A 35-year-old female presents to the primary care clinic for a routine checkup. Upon auscultation, the nurse hears a harsh, blowing sound heard best at the second right intercostal space during systole. Which condition is most likely causing this abnormal heart sound? A. Atrial septal defect. B. Mitral valve prolapse. C. Aortic stenosis. D. Tricuspid regurgitation. The correct answer is C. Aortic stenosis. Explanation. Aortic stenosis is characterized by narrowing or obstruction of the aortic valve, leading to turbulent blood flow during systole. The harsh, blowing sound heard best at the second right intercostal space is known as a systolic ejection murmur and is characteristic of aortic stenosis. An atrial septal defect is associated with a wide and fixed split S2. Mitral valve prolapse is characterized by a mid-systolic click and late systolic murmur. Tricuspid regurgitation is associated with a holosystolic murmur heard along the left sternal border. A client diagnosed with hypertension is prescribed a thiazide diuretic. The nurse understands that the primary action of this medication is to A. Increase systemic vascular resistance. B. Decrease cardiac output. C. Promote sodium and water excretion. D. Inhibit the renin-angiotensin-aldosterone system. The correct answer is C. Promote sodium and water excretion. Explanation. Thiazide diuretics, such as hydrochlorothiazide, are commonly prescribed for the management of hypertension. These medications act on the distal convoluted tubules of the kidneys, promoting the excretion of sodium and water from the body. This increases the excretion of sodium and water, resulting in decreased blood pressure. Option A, increase systemic vascular resistance, is incorrect because thiazide diuretics actually have the opposite effect. They help to reduce blood pressure. Option B, decrease cardiac output, is incorrect because thiazide diuretics primarily work by promoting sodium and water excretion rather than directly affecting cardiac output. Option D, inhibit the renin-angiotensin-aldosterone system is incorrect because thiazide diuretics do not directly inhibit this system. Instead, they primarily act on the kidneys to promote sodium and water excretion, as mentioned earlier. A client is admitted to the emergency department with symptoms of hypotension. The nurse suspects hypovolemic shock. Which of the following interventions should the nurse prioritize? A. Administer a vasopressor medication. B. Initiate fluid resuscitation. C. Place the client in Trendelenburg position. D. Administer a beta-blocker medication. The correct answer is B. Initiate fluid resuscitation. Explanation. Hypovolemic shock occurs when there is a significant loss of intravascular fluid volume, leading to decreased cardiac output and subsequent hypotension. The priority intervention for this client is to initiate fluid resuscitation to restore intravascular volume. Administering intravenous fluids, such as isotonic crystalloids, for example, normal saline, helps to expand the intravascular volume and improve tissue perfusion, thereby correcting hypotension. Option A, administer a vasopressor medication is incorrect because while vasopressors may be used in certain cases of hypotension, such as septic shock or cardiogenic shock, the primary intervention for hypovolemic shock is fluid resuscitation. Option C, place the client in Trendelenburg position, head down, legs up, is incorrect. It may increase venous return to the heart but does not address the underlying issue of fluid volume loss. The priority intervention is fluid resuscitation. Option D, administer a beta-blocker medication is incorrect because beta-blockers are not indicated in the management of hypotension, particularly in the case of hypovolemic shock. Beta-blockers reduce heart rate and contractility, which can further decrease cardiac output and exacerbate hypotension. During a physical examination, the nurse hears a lub-dub sound while auscultating the client's heart. Which of the following heart sounds is the nurse most likely hearing? A. S3 heart sound. B. S1 heart sound. C. S4 heart sound. D. Split S2 heart sound. The correct answer is B. S1 heart sound. Explanation. The lub-dub sound represents the normal heart sounds heard during cardiac auscultation. The first heart sound, S1, is produced by the closure of the mitral and tricuspid valves during ventricular systole. It is often described as lub and is the first sound heard in the cardiac cycle. Option A, S3 heart sound is incorrect because S3 is an abnormal heart sound that occurs during the rapid filling of the ventricles in early diastole. It is commonly associated with conditions such as heart failure. Option C, S4 heart sound is incorrect because S4 is also an abnormal heart sound that occurs when the atria contract and push blood into stiff or hypertrophic ventricles during late diastole. It is commonly heard in conditions such as hypertension or coronary artery disease. Option D, split S2 heart sound is incorrect because split S2 refers to the splitting of the second heart sound, which occurs due to a slight delay in the closure of the aortic and pulmonic valves. It is typically heard during inspiration and is considered a normal variation.